I'm Rob Peterson and I'm 55 years old. I recently suffered what seemed like it could be a career-ending shoulder injury. I can't say that I've completely recovered, but I've progressed enough now that I'm comfortable saying that I'm definitely on the road to recovery. I'm not pain-free, but I'm in less pain all the time, and that's while working out hard over the last several months and regaining most of my strength. Along the way, I've learned a tremendous amount about shoulder anatomy, joint injuries, and how to recover from joint injuries, and I'd like to share that with you guys. I can't cover everything I want to say in one video, so in this video, I'm going to focus on physical therapy. Before going through it, I actually had a very wrong idea about what physical therapy was supposed to accomplish. I thought that the main idea was to heal your damaged tissues. And to some extent, it can help with that, but that isn't the main purpose. The main purpose of physical therapy is to help teach you how to move better and to build strength in the surrounding structures. If you're successful, then the damaged joint tissue will be better protected, you'll stop adding to the damage, and hopefully the damaged tissue will start healing. Okay, so a year ago, my right shoulder was in pretty bad shape. The kind of shape that makes a lot of people say, you know, I'm too old for this shit. It's time for me to retire and take up shuffleboard. I was in pain most of the time. My workouts were terrifying, and I couldn't sleep on my right side at all. I finally went to the doctor and had x-rays and an MRI. The scans showed a bunch of damage, but the main things were 2 tears in one of the rotator cuff tendons and degenerative tearing of the labrum. When I saw all that damage, I was pretty freaked out. My official diagnosis said that one of the 2 tears in my supraspinatus tendon was a half-thickness tear, and the other one could be a full-thickness tear. That sounds really scary. And the degenerative tearing of the labrum also seemed really bad to me. My understanding at the time was that the labrum doesn't heal on its own, and that surgery was unlikely to work for someone of my age. But one thing that I've learned since then is that you shouldn't be overly freaked out by what you see in scans. For one thing, most people my age, not even athletes, just people selected at random, have degenerative tearing of the labrum. It's to be expected for people of my age, especially athletes. And all that damage doesn't mean what you think it does. It doesn't necessarily condemn you to a life of pain and minimal function. Most injuries of this type, degenerative changes caused by overuse or athletic activities, can be overcome with exercise and physical therapy. But at the time that my doctor was going over the scans with me and explaining what my injuries were, I didn't understand all that, so I was pretty freaked out. And I'm not a normal patient, right? I don't just want my shoulder to stop hurting. I want to be able to get back to hardcore working out. So I tried hard to explain that to my doctor. I described what I do, and I even showed her my YouTube channel. I tried hard to explain that what was really important to me was not just being pain-free, but getting to a point where I could work out again. And my doctor was really great. She said yes, she thought that physical therapy would work for me, and yes, she even thought I would be able to get back to my unconventional activities. Or at least that I had a good chance. And she even managed to hook me up with a physical therapist who had been a gymnast. So I decided to not just do the physical therapy, but really lean in, really give it my all. But before I get to that, let me back up just a little bit. Before I finally went to the doctor, I spent months doing my own research. I watched a zillion videos about how to diagnose your own shoulder pain. And I started doing exercises meant to bulletproof your shoulders or to strengthen your tendons. But it turns out there are really good reasons to see a doctor. One thing is that a doctor or a physical therapist can observe your movement patterns from the outside, which you are not able to do. And even though you have a degree from the University of Google, they actually know more about anatomy than you do. So they are better than you are at figuring out what the root causes of your problem might be. I would have been better off going to the doctor a lot sooner. The first thing that both the doctor and later the physical therapist did was to have me take off my shirt and then perform a series of movements with my arms. You know, lift your arms, now bend them this way, now rotate. And of course, they were able to see things related to my injury, like my range of motion with internal rotation on the right side was limited. But they both also noticed something else. My shoulder blades didn't move in an optimal way when I raised and lowered my arms. And they said it was likely caused in part by certain muscles, middle and lower traps among others, being too weak. and that this poor movement pattern had probably caused some impingement, which had, over time, probably contributed to wearing down the supraspinatus tendon, which was the main thing that was severely damaged. And I was like, excuse me? Do you know who I am? I am the aging warrior. I've got a YouTube channel and everything. I am not weak. And they're like, no, sorry, you're weak. I was very surprised by what the physical therapist had me do. It was very different from what I imagined. She started me off with a childishly easy exercise. I'm almost embarrassed to show it to you. These are called rock backs, and the purpose is not to improve flexibility or to strengthen anything. The purpose is to help teach the scapula to track correctly as your arms move up and down. If you do this one right, you can really feel your scapula moving up and down. They also started me doing some simple internal rotation exercises. The purpose of these was to help my shoulder coordinate proper rotational movement when the scapula is not moving. And they had me do some thoracic spine stretches to help improve my posture, which, like many people who work at a desk, tends to be a bit hunched forward. Then, after a few weeks doing that kind of thing, they gradually added exercises to strengthen the muscles that stabilize the scapula, and exercises that promote shoulder stability through a range of positions. I'm deliberately not going into details. You shouldn't try to copy what I did because your case might be different than mine. If you're injured, you should go see a doctor. Also, my physical therapist did agree that the exercises I had been doing before starting physical therapy, internal and external rotation exercises, as well as exercises like the full can done with load, can help strengthen the damaged rotator cuff tendons. So, she encouraged me to keep doing those, but she strongly felt that the other factors are much more important. Teaching the scapula and rotator cuff to move properly to support the motions of the shoulder and arm, and strengthening the muscles that hold the scapula in place so that it provides better support for the shoulder joints. The scapula is like a floating bone. The only rigid attachments it has are to the upper arm and to the collarbone, which are themselves very mobile. Everything else it attaches to are muscles. So it can move up, down, left, right, and rotate quite a bit. So it has to be very mobile because it has to move to all different positions to support various movements of your arm. And it has to be very stable because it has to remain locked in the correct position when a large force is applied to your shoulder. So you need the muscles that support the scapula to be both very mobile and very strong. And let me just put this into a calisthenics framework. When you're doing fast muscle-ups, say, your scapula has to move like crazy to maintain good positioning at the points where load suddenly comes onto your arms. Like when you hit this position and you encounter a sudden force in this direction. Or when you get to this position and you suddenly have a force in this direction. Especially at the bottom, where you momentarily encounter a force of probably 2 or 3 times your body weight. If your scapula isn't getting to the optimal position at the moment where all that force is applied, then you're probably going to be accumulating micro damage to the tendons that hold your shoulder together. That's the importance of mobility. And about stability, think about a planche. It's a static position, but tremendous force is being applied to your shoulders in an awkward position. And a lot of that force is transmitted to the scapula, which would tend to move it out of its optimal position. And the further the scapula moves away from the optimal position, the more stress your rotator cuff tendons and other tendons and ligaments in your shoulder are going to be under. That was almost certainly the straw that broke the camel's back in my case. See my previous videos. So if you were injured and I were giving you advice, I'd say, go to the doctor. Don't be like me and just try to do your own research. Go to the doctor. They have more perspective than you do. Things may not be the way you think they are. And number 2, if you do physical therapy, remember that it's an active process. You get out of it what you put in. You very much need to take an active role. Don't just blindly do the exercises. Ask questions. Try to understand why they're having you do the things they're having you do. The exercises are always hard to do correctly. It really helps to understand what you're supposed to be doing and why. And also do your own research. There's nothing wrong with going on Google or YouTube and trying to get a better understanding, as long as you also listen to your doctor or physical therapist. You have information that they don't, right? You actually live inside your body. Your pain gives you direct feedback. Also, it's important to remember, 50% of doctors and physical therapists are below average. You might get unlucky and get a bad one. So, be involved, ask questions, change doctors if you need to. Try to take as much control of the process as you can. If you do that, if you struggle to understand, if you take an active role and work hard, then your chance of a good outcome will be much higher. Alright, that's it. Thanks for watching. I hope that this video helps a few people out there. Leave a comment if you have any thoughts or any questions. Let me know if you think I got things completely wrong. As with most of my videos, I'm not an expert in this topic. Don't forget to hit the like button if you enjoyed the video and subscribe for more content like this. Good luck with your training, and I'll see you in the next video.